care of so many patients. For the latest, here's CNN's Melissa Bell.
Listen up!
The front line of Europe's battle against the coronavirus, with its soldiers in a race against time that is so far being lost. Northern Italian hospitals like this one in Cremona already creaking under the strain. Dr. Angelo Pan shows us around its operating rooms, now transformed into makeshift intensive care units, the ICUs themselves overwhelmed by the sheer number of COVID-19 patients.
There is not enough room in the ICU. If Milan will be badly struck by the outbreak, it's going to be a big problem for everybody.
Beyond the shortage of beds and ventilators, the doctors getting sick themselves. Dr. Pan has had one day off in the last 6 weeks. He says total confinement is the world's only hope.
We can win the battle. If the people will keep on having contacts with each other outside in the restaurants, in the bars, in the supermarkets, and so the infection will spread, will keep on spreading, and it's going to be very tough.
And his message from the front line to the outside world?
I mean, if you're not involved in the war in the hospital and that you're not an healthcare worker, stay home and think about life. This is a good opportunity.
He said total confinement was the only way to beat the spread. It's going to be difficult to have total confinement if, first of all, you have people dying and somebody has to do something with the corpse. You can't just leave the corpse in the house. Other people has to live in the house too. So naturally, you're going to have somebody come and pick up the corpse. Then, most people don't have big ice boxes or big freezers that they can store a lot of meat in. I mean, I have yet to go to this Walmart up here in Martin and there be a meat supply chain up there with meat. It's all gone. About $20,000 worth of meat will be gone just within a matter of an hour or so whenever the truck comes in there and makes a delivery. People are standing in line towards wanting to get supplies, regardless whether it's meat, regardless whether it's toilet paper, regardless whether it's sanitary stuff pertaining to bleach and Lysol. I mean, people are still having to mix and mingle, so you don't have a total confinement. A total confinement would almost be next to impossible unless you was already pre-designed, pre-set up to where you was advanced with enough warnings that you could have properly prepared for this. And the majority of the people are not properly prepared for this. I don't care if you're in America. I don't care if you're in Russia. I don't care if you're in Canada. I don't care if you're in Sweden or Italy or wherever. But this is a true pandemic that really and truly should have been announced within the second to third, no later than the third week after we was getting the information back from China, which I'm sure was tainted, which I'm sure wasn't completely accurate. But within the last part of January is whenever the world should have recognized this towards it being this serious. For some reason, the world, watching all those numbers increase over in China, must have thought that it was invincible of this horrible disease, of this horrible pandemic. And of course, we know that it hasn't been until just within the past couple of weeks here in America that it's been announced towards being a pandemic, and that these type of measures are now starting to be implemented here in America. It's not just a matter of washing your hands. It's a matter of mixing and mingling. And it doesn't matter if you're in a bar, it doesn't matter if you're in a restaurant, it doesn't matter if you're on a beach, it doesn't matter if you're in a Walmart, it doesn't matter. Where you're mixing and mingling is where you're distributing each other's coughs and each other's colds and each other's this and that. Same way with touching money. You know, money ain't sanitized. Who was handling that money before you handled it? You have no idea. This is just about as serious gets, other than a meteor the size of Texas falling and hitting the planet and putting the whole planet into a state of extinction. This is the next thing to that. You can't get any more seriouser than this. Unless it was an actual meteor that fell from the sky. This is a wake-up call for the world, for the planet.
An important plea from that doctor there on the front line. CNN's Delia Gallagher has been following the story about Italy from Rome, and it just seems like every day when people are looking for good news, it just doesn't come, Delia.
Well, that's right, Natalie. This has been a difficult weekend here in Italy with these high death tolls. Out of the 4,800 total dead, 3,000 of them are in the Lombardy region. And the Lombardy region is one of the richest regions in Italy and has the best hospital structures. So obviously there is concern that were these kind of numbers to spread to other regions in Italy, if Lombardy can't handle it, it would be very difficult for other regions as well. Now, one health official in Lombardy did say yesterday that experts had warned them that this weekend, which is 2 weeks on from their lockdown in the north, would show some of the worst numbers, and that their hope is that by Monday they will see a reduction in infections and in deaths. You can imagine that it has created solidarity throughout the country. There was a call for 300 doctors to go to the north from other parts of the country. Well, they got 7,000 responses on that, Natalie. So certainly Italians stepping up, trying to at least go and help those doctors and nurses who are exhausted in the northern regions to help out in this effort, Natalie.
That is just amazing that people will risk their lives to help this situation. It just goes to speak to the bravery and the dedication of these healthcare workers. It's really tremendous.
It's humbling. It's really humbling whenever you see people that's willing to put their own lives on the line towards trying to help other people. It's absolutely humbling to know that they're walking into a war zone. And that's exactly what it is. It's a war zone. Knowing that when they walk in, they may be carried out. It's humbling to see that people are willing to do this for other people. Strangers, people that they've never met before, people that they may not never meet again. It's humbling to see such solidarity. I've never seen nothing like it. And I have been through some horrible, horrible situations in my own personal life, and I have experienced many different catastrophes on a Katrina level versus a hailstorm, or a tornado, many tornado storms. I've been in lots of different catastrophes, and this one here tops it, which once more speaks volumes about the trueness of the Bible. For Christ said in his teachings that in the last days that we would see signs up in the heavens and signs up onto the earth, such as mankind has never seen before, such as humanity could not even begin to fathom or think about, are occurring on a day-to-day level. They almost had 900 die in one night. If that does not wake up somebody, they obviously are either brain dead or they don't understand the struggles between death and life. When you see something like this that's occurring, it is absolutely breathtaking. You know, whenever we see big catastrophes like this, I'm just going to use the catastrophe that happened over in Japan whenever the earthquake happened and the tsunami wiped out, give or take, around 500 million people. Or not 500 million, 500,000 people. I think it was 500,000. Which is almost a million people. You know, whenever you see that massive water come in and literally just take out cities, and you know good and well that as you was watching those pictures of the houses being moved off of their foundations and cars floating around and bobbing around like a bunch of bobbers, you know, if you got any sense of reality at all, that there was people in those homes, especially whenever you see people swimming in the currents that drowned that many people, that destroyed that many lives. Whenever we see these type of catastrophes happen in front of our very eyes, it's almost unbelievable for our little finite minds to wrap around a catastrophe such as this, because it's something that we've maybe read about or seen scripts of Hollywood that has produced movies like this that was supposed to be generated or formulated in the form of something science fiction. So it's almost hard for people to grasp the intensity, the gravity of something this huge, something this big, that is as serious as life in and of itself pertaining to death. It's horrifying enough for the person that's experiencing this, but it's even more horrifying for the people that's witnessing the people that's experiencing this, knowing that it's coming near a neighborhood near you. Or it could possibly be, unless there is some sort of a way to contain it or keep it from spreading or some sort of antidote to keep it from being as lethal as what we're seeing of it being. It's just, it's almost unimaginable. It really is. It's hard for the human mind to wrap his or her mind around this in the sense of the reality of what the gravity of all this is.
That's the bright spot. We'll leave it on. Delia Gallagher in Rome. Delia, thank you. COVID-19 cases have spiked dramatically in Spain with nearly 5,000 new cases reported in just one day. That brings the total number to nearly 25,000, making Spain the third hardest hit country in the world behind China and Italy. Al Goodman is live for us in Madrid right now. Al, talk with us more about the inventive ways that Spain is looking to try to stem this pandemic as it starts to grow there.
Hi, Natalie. Well, the medical teams are really scrambling. The government is scrambling to get enough hospital beds in place and to get enough doctors in place. And the reason is because the figures you just mentioned, the 25,000, nearly 25,000 cases in Spain is triple of what it was just at the start of last week. And the number of deaths, 1,300, is 10 times what it was at the start of last weekend. That's why the Prime Minister on Saturday night warned the nation the worst is yet to come. It will test the limits of the nation. All of this, there's a lag time between the stay-at-home order, which also came into effect last weekend, a little more than a week ago, and it's largely been respected. The streets, as you can see, I'm right here in the center of Madrid, are empty. And the few people who tried to get around that, there are fines. The police have just stopped us just here before this live shot to say, what are you doing here? So most people are staying home. But there's a lag time, and that's what this calm before the storm has forced all of these inventive ways for the authorities. So they are using, there are currently 2 hotels here in Madrid, which is the hardest hit part of the country for the cases and the deaths, that have been converted into hospitals, and now 7 more are going to be converted in the next couple of days. The big convention center out near the airport is now a makeshift hospital, 5,500 beds that were assembled there very quickly by the military. And the buses, as you say, are transporting the ambulatory, the people who can still walk, to some of these facilities. Meantime, the Spanish authorities are competing with other countries around the world. Everyone, all the countries are scrambling to get masks, the testing kits, and the hand sanitizer to try to have enough for their medical teams and for the population. The Spanish authorities are going to be producing, they say that companies in Spain, there's a lot of manufacturing muscle in this country, are able to produce that. The military is helping to produce the hand sanitizer. So they're working all of these things all at once, and they're just really, it's a race against the clock to have enough intensive care beds as this next wave, which is expected here in this coming week, comes on, and more patients are heading for the hospitals. Natalie?
Those hospitals spread out everywhere now. At least we see some inventive ways to bring more beds to the country. Al Goodman for us there in Madrid. Al, thanks so much for your reporting. The U.S. government has approved a COVID-19 test that could speed up the verifications of new infections. That kit promises to deliver test results in just 45 minutes instead of days. But as cases soar in the U.S. past 25,000 now, there are new guidelines on testing. Melissa Rainey has that for us.
The number of coronavirus cases climbing as tens of thousands of people have been tested. And now some doctors are signaling a shift in their testing strategy.
Not every single person in the United States needs to get tested.
Health officials in New York City and Los Angeles are recommending doctors avoid testing patients, except in cases where the result would significantly change treatment.
When you go in and get tested, you are consuming personal protective equipment, masks and gowns.
This comes as healthcare workers are sounding the alarm, saying medical supplies like masks and gloves are starting to run out.
We absolutely feel like we are in this alone as doctors, nurses, paramedics, and even hospitals.
The White House Coronavirus Task Force says those much-needed supplies are on the way.
HHS just placed an order for hundreds of millions of N95 masks that will be being made available to healthcare providers across the country.
Meanwhile, President Trump urging Americans to heed warnings from federal health officials to slow the spread of coronavirus.
Every American has a role to play in defending our nation from this invisible, horrible enemy.
On Saturday, more than 1/5 of Americans were under orders to stay home. That's about 75 million people in Connecticut, Illinois, New York, and California, where authorities say only a
75 million people right now in America is under voluntary mandatory quarantine. 75 million. And I'm sure this week that number will go up. That's basically in 4 major areas, but before long we'll see the same thing that will hit Miami, Tampa, Daytona, Orlando, Jacksonville, all your major areas down in Florida, and then you can just go from state to state to state. That would just increase the numbers. And I don't know if it will be so much mandatory of the governor doing that, or if it will be mandatory of the mayors of various cities that's going to be doing that. But it's definitely knocking on our door, coming near a neighborhood near you.
essential workers are allowed away from home.
Stay at home and save lives. This is a time of shared national sacrifice, but
I'm Melissa Rainey reporting.
Treasure our loved ones.
The death toll in Iran has topped 1,500 people with more than 20,000 cases reported. A mall in Tehran is now being turned into a makeshift hospital. Supreme Leader Ayatollah Khamenei addressed the nation last hour, urging followers to follow health officials' recommendations and have patience. He also accused the United States of creating the virus and said the country would refuse all medical aid from the U.S., fearing any medicine from the U.S. could be used to harm Iranians.
See, that's crazy. That's absolutely insane. You got these wild ideals of people fabricating who to point the finger at, knowing good and well that the virus come from China. It come from China, Iran. It didn't come from America. The original origin come from China over people eating bats or eating raw fish or eating raw squid or eating raw octopus or eating raw something. I'm pretty sure it was bats. Now it's mutated. But Iran's got to have somebody to blame now, doesn't it? It says in the Bible that Satan will rise up in great wrath in the last days, because he knoweth his time is short. And we're seeing the results of the great demon. We're seeing the results from Satan that is rising up, just like it talks about in Revelations, in great wrath, by generating this type of disease amongst the human population that is now wreaking havoc upon to humanity. That's what the people should be looking at. That is where the finger should be pointing. Not to God, not to the United States. It wasn't an alien that done it. Its original origin come from China. But you got to recognize who actually has created something this powerful, this dynamic, that can literally take out a third of the population on the planet. I hope to God that it doesn't, but from all indication, it looks like it's knocking on the door. You're not going to get no more serious than this. The only thing any serious than this would be if a meteor the size of Texas fell out of the sky and hit the planet Earth. Then you could compare that event, hypothetically speaking, to the event that's actually happening right now pertaining to our new reality.
That's the message from the Supreme Leader. Well, here to discuss more is Peter Drobak, a global health expert at Oxford.
That's just absolutely disgusting. To think that a leader from a country would blame the United States and would be willing to sacrifice its own people if we had any type of medical supplies to offer to Iran, that they wouldn't accept them, afraid that they would be tainted or poisoned. That is so sickening. It just blows my mind to think that anybody would think that. It's horrifying to think that anybody would think that.
Said Business School. Thank you so much for coming on.
Horrifying.
Peter. I want to ask you first up, what have we learned from Italy and Iran, for that matter, about the spread of this virus and how difficult and the challenge it is of containing it?
I think the big lesson from Italy and Iran is that complacency is lethal and speed is really of the essence. Once you start to get behind this virus, we've seen how quickly it gets out of control because of how quickly it spreads. And all the successful examples we've seen around the world have really come down to early and aggressive action in places. You know, we're hearing from Italy every day, from doctors and from political leaders, don't be like us, act now, act quickly. And I think that's such an important message.
But we know that countries haven't got ahead of this, and the United States is perhaps next. You said 1 week ago that the U.S. is courting catastrophe because of serious problems with testing. Coronavirus has been silently spreading in the U.S. for nearly 2 months. What could that spell for the United States?
So according to some of the best epidemiologists out there, the worst case scenario in the U.S. could involve about 2.2 million deaths in the country, with the majority of the population being infected. So it's quite a sobering potential scenario that the country is headed for, but it's not too late to act.
Well, and states are acting. California started it, ordering 44 million people to stay home. New York followed, Connecticut, Illinois, I believe New Jersey is doing the same today, on Sunday. How critical is this action right now by states?
All of these measures are critically important and need to be ramped up as much as possible, and not just in the hotspots, but probably elsewhere as well. One thing we know about this virus is that on average, every infected person will infect 2.5 to 3 other people. And all of these so-called social distancing measures that we're now experiencing are designed to bring that number down to below 1. And so each piece of the puzzle here, that's closures of mass gatherings, school closures, keeping folks home from work, and really minimizing any social contact. Every single individual action that we can make to do that helps us win this fight.
Mm-hmm. Well, what countries have been an example, Peter, of getting ahead of it and being proactive?
There are several countries in Asia, notably Singapore, South Korea, Taiwan, and Macau as well, that have really been able to contain this virus, at least for now. South Korea is a really interesting example because they also were caught a bit flat-footed and had an initial surge in cases, but were able to bring it under control. The lesson from all of those countries in slightly different ways is involving widespread testing and efforts to isolate and trace contacts when possible. We may be getting behind that in the U.S. Aggressive but targeted social distancing measures. Most of these countries were able to reach this containment without implementing a full widespread lockdown like China and Italy have done. Singapore, for example, never had to close its schools. So those things are really important. Again, we're a bit behind the curve, and I think we need to do all of those things, but we also need to be working overtime to prepare our health system for the coming surge.
Right. The United States doesn't even have enough, masks and protective gear for the people on the front lines. Let's talk about the conflict between politics and science. There are people in the U.S. that they have thought this was a hoax. And misinformation has been the worst thing surrounding this pandemic. And many have even pointed the finger at the White House for contributing to the tragedy. How do we combat misinformation?
Well, it's very challenging because it can come from all sides, and of course, it's difficult to control in places like social media. What we know is that in a pandemic situation, transparency and clear communication is so important, and accurate information, because we all need to work together and everyone needs to make sacrifices. And so every person that doesn't do his or her part because they may think this is not serious, it won't affect them, that it's a hoax, really puts the rest of us at risk. From the standpoint of the U.S. government, we've seen some hopeful signs over the last couple of weeks. What's really important is to put the experts in charge, let the experts drive the messaging, and to give them the resources that they need to succeed.
Exactly.
Right. Dr. Tony Fauci has been like a household name through this, has he not? We've really been looking toward him. We appreciate your expertise. You're a global health expert. You've worked in many different countries, helping them with their health systems, and we hope to talk with you again. Peter Drobak for us. Thank you, Peter.
Thank you.
A warning for British families from the Prime Minister. Boris Johnson says, show your love by staying away this Mother's Day holiday. That is today in the UK. Also, as the number of cases soar and as the world tightens restrictions, where did the disease come from? We'll explore what some scientists are thinking about that.
Vingroup.
COVID-19 is making this a very different Mother's Day for the United Kingdom. Prime Minister Boris Johnson asking the British people to show their love by staying away from family and friends on this day. He warns that the spread is accelerating and says now is the time to engage in social distancing. Otherwise, the National Health Service, he says, could be overwhelmed. Confirmed cases of the virus jumped by more than 1,000 Saturday, bringing total cases in the UK to just over 5,233 people have died. And France is now reporting the biggest one-day hike in deaths from the coronavirus since the outbreak began, with well over 14,000 cases of COVID-19 confirmed in that country. The death toll soared on Saturday by 112. So far, more than 560 people in France have died from this disease. Let's bring in our reporters. Hadas Gold is in London for us and Melissa Bell in Paris. Good morning to both of you. And Hadas, we'll start with you on this Mother's Day. It's not the day, says the Prime Minister, to visit your mother.
No, it's an unusual Mother's Day here for the United Kingdom. Prime Minister Boris Johnson warning in both an address in a statement to the nation yesterday and in an opinion piece this morning in the Sun newspaper, saying this Mother's Day, the best present we can give to those who gave us life is sparing them the risk of coronavirus. He is urging people not to go visit their parents, not to go visit their mothers, instead to call them, video chat with them, because he is warning that by visiting them, you could be spreading the coronavirus even further. And he is issuing a stark warning to the country, saying, look at Italy. Look at how overrun Italy's hospitals are. He's saying that they have a superb healthcare system that's similar to the national healthcare system here in the United Kingdom, and that the UK is only 2 to 3 weeks behind Italy in terms of the number of cases. And he is warning that if people do not adhere to the social distancing, despite the fact that they've already closed down pubs and restaurants, cafes, movie theaters, and the schools, he's saying if people don't pay close attention to the social distancing rule of not gathering in groups, of staying in your homes, then the healthcare system in the United Kingdom will be overrun. It's a very stark warning for people. But in some good news, in the last few days, there's been a call for retired healthcare workers to come out of retirement, to come back into the national healthcare system. And officials say that within the first 48 hours, 4,000 nurses and 500 doctors have signed up to come back into the force.
Wow.
That is tremendous. Such
That's
dedication
impressive.
in these dire times, in these dangerous dangerous times for these frontline healthcare workers. Hadas Gold for us there in London. Thank you. Now to Melissa Bell. She is in Paris. You're there. Good morning to you on the beautiful background. I'm wondering if you're seeing many people outside on a Sunday morning there, Melissa.
No, Natalie, the streets are really deserted here in front of the Senate, here in the center of Paris. It's been tough for authorities to convince people that they had to stay inside. We saw this in Italy when the first lockdown measures were brought in nationwide there. We're seeing it in France now. It just takes a few days for people to understand that this is going to affect them and profoundly change their lives for a while. In fact, what we've seen is French authorities having to up the fines. So if you get caught once, twice, 3 times, by the 4th time, if you're out without the authorization that you fill out to explain why you have to leave your home at that particular point, food shopping, helping an elderly relative, for instance, you can actually go to prison. So they've had to really tighten things down simply because every day they were having to give out thousands of fines to people who were not taking this seriously enough. And as you say, those figures here continuing to rise. We've now have nearly 15,000 cases here in France, but we had an interesting press conference delivered by the health ministry yesterday who said that actually what they suspect is that the number of cases could be much higher than that, anywhere between 30,000 and 90,000 in France, according to the French health minister. And that is for several reasons, Natalie. First of all, the asymptomatic nature for some of COVID-19, the fact that some will get through it with symptoms of a mild flu, and the fact that it is simply just very difficult in this country to get yourself tested. Even having the symptoms of COVID-19 is not enough to get yourself tested necessarily. You have also to be living with an elderly relative or be having trouble breathing. So because of that difficulty, it's very hard to have an exact idea of the number of cases, but they could be far higher than the official statistics, Natalie.
Yeah, absolutely. The time has passed for people to comply, has it not? All right, Melissa Bell for us in Paris. Thanks so much. Well, Germany's capital is tightening its restrictions. Berlin limiting gatherings to no more than 10 people, and restaurants are restricted to pickup or delivery only. This comes one day after the southern state of Bavaria restricted the movement of its residents, telling them to stay home. The number of cases in Germany rose by nearly 20% Saturday. Well, crashing markets and shuttered businesses are taking their toll on the world economy. We'll dive into the economic impact of the coronavirus pandemic with an economist. I'll talk with him coming next.
Is cleaning the outside of your house an exhausting all-day affair? Reports indicate that millions of American workers and their families have been exposed to the dangers of aerosol asbestos fibers in the workplace and at home. As
the change, having gotten infections outside of mainland China. So one of the measures that the authorities have announced is to divert all flights headed to Beijing, all international flights, to 12 other cities where people would have to get out to then be checked, and only when approved they could then get back on the original plane and fly on to Beijing. Just one more remarkable measure that the Chinese authorities are using to try to restrict the spread of this deadly pandemic.
Right, and you're there in Hong Kong, Ivan. It's also trying to contain a new outbreak. What is life like in Hong Kong these days when you step outside?
It's busy. It's a beautiful Sunday afternoon. There are many people and their families out walking, enjoying the sunshine. I've got sports fields below this balcony here where kids are playing, and that's understandable because people have been cooped up. Their kids have not been going to school since the end of January. And this was a good news story because Hong Kong, right next to mainland China, had succeeded in keeping the number of infections down. But there's been a surge of scores of new cases in the last couple of days, the most in a single day on Friday, 48 new cases. The Hong Kong authorities say that most of these new cases that are being detected are also imported cases. So as of Thursday night, midnight, the Hong Kong authorities say anybody flying in here outside of mainland China and Macau have to go into mandatory 14-day quarantine. They're even giving electronic bracelets to people to do that, and they're getting tighter on restrictions. Come Monday, all civil servants have to stay home. All public facilities are going to be closed. These were measures that were in place in February that were loosened and now are being reintroduced as the Hong Kong authorities fear that their city is backsliding.
All right, something to watch. Ivan Watson for us. Ivan, thank you. Well, of course, we were talking about Wuhan. That is where this outbreak started. But where did the disease actually come from? Some scientists think they may have an answer, and we'll have that story next.
Do you have an idea?
Why do you need new shades? After 40, I got...
People over 65. People with underlying medical conditions like
and also grassy surfaces. I think as long as we keep those roads treated, the good news is the roads should mainly just be
job done. It's 10.5 centimeters of awesome. Unless
it's on its way when the seed begins to leave your hand.
You know, I got you one for because I thought you'd like one. This holds 1,000. I've got 134 books.
Thing, and it was a good thought, but I had no basis upon it. Now,
to the skeptical person, I would say this.
To do it, what I could live off of, and one of the things I always love, space.
In times when electricity costs are high, which helps reduce your electric bill.
Harvard, what company?
Power.
Hi there, I'm Patrick Snell with your CNN World Sport headlines as the pressure continues to mount on Tokyo.
This is going to change this country.
Look, I'm an optimist. I think that this crisis actually provides us an occasion to rediscover our shared sense of American solidarity. And if that's a silver lining in all of this, then I think it's going to be one that we should be grateful for. I will say that in times of crisis, we might face a temptation, as we have in the past, to surrender to calls for authoritarianism. We've seen it in the past during the Great Depression, when you heard some Americans calling for learning lessons from the efficiency of Nazi Germany. Today, we're hearing some early whispers of the same for China's success story in combating the virus. But I actually think today, in this particular moment in the COVID epidemic, provides us an occasion to remember that authoritarianism may actually have contributed to turning that initial local epidemic into a global pandemic through the suppression of physicians, the ordering of physicians in China to cease testing and destroy samples. And while China has reported a decline in new cases using their autocratic methods, I think is also an opportunity now for America to step up to show that even as a liberal democracy, we too can conquer this virus. I think it's also an occasion for us to remember that, look, all Americans, male or female, black or white, Republican or Democrat for that matter, share an equal vulnerability to this virus, and really a reminder for us that we all truly share something in common here.
And do you think that, just on that point, I want to elaborate on that, that will, this has been a very divided country. We're divided along partisan lines. People, as you say, have been identifying themselves increasingly in the last 20 years on their race, their sex, their sexual orientation. Is it really possible that this could? I remember 9/11. 9/11 came along. People said the same thing about 9/11, and we were united. The country was united for about a year afterwards, and then we were back to squabbling again. Is this really likely to change?
I think it is, at least in the near term, and I hope we take it for the long run. In the 20 years since 9/11, we've done a great job of celebrating our differences and sometimes quibbling over them. I think this is an occasion to remember our commonality. And to that end, I'll tell you a couple stories, Jerry. I was talking to my wife last night. She's an ear, nose, throat doctor. She's 3.5 weeks into maternity leave. We just had a child 3.5 weeks ago.
Oh, man.
She told me last night that as a ear, nose, throat doctor, she is going back to the hospital in the next couple of days. I was uncertain about that decision, but she told me that the fireman doesn't run from the fire when the building is burning. And I would say that doctors like her across the country are our true American heroes right now.
Absolutely.
Even at our own company, I've been on the phone around the clock with our development team trying to advance our therapeutic, working with regulators. I think the employees at our company, I think the employees at FDA are true American heroes. Now, of course, we all wish this crisis never occurred.
Sure.
But if we are to take something productive from it, let it remind us of what we all share in common as a people. And I think it can also remind us of what true heroism is all about.
Yes.
As we saw in 9/11, let us, I think take this as an opportunity to discover something that might have been missing over the last couple of decades since.
Vivek, thank you very much indeed. Thank you to your wife. Congratulations to you.
Commonality pertaining to what we all have in common, which is life, which is survival, which is each other. Wow.
Till they, or where they live, comes under stress.
We believe that the impact of stress on bats would be much the same as it would be on other mammals, including people, and that is that it would allow any infections to increase and to be excreted, to be shed. You can think of it if people get stressed and they're infected with the cold sore virus, they often will get a cold sore. So that's the virus being expressed. And this can happen in bats too. It's easy to point the finger at the host species, but actually it's the way we interact with them due to habitat encroachment, due to increased hunting.
Experts point to shipping bats near other animals in so-called wet markets in China. This one in Wuhan believed to be the epicenter, where stressed animals transfer diseases easily to each other and then maybe humans. Well, there's a term for this that you're going to have to get familiar with. It's changed our lives. It's called zoonotic transfer or spillover.
The underlying causes of zoonotic spillover from bats or from other wild species is almost always, in fact, I think it's always been shown to be human behaviors, human activities that are causing this.
In the past, people infected by animals in remote places would die or recover before they could spread it. Today, they can get on a plane to a different city that night.
We've got so many humans, so that any kind of spillover that might have happened in the past is magnified by the fact that there's so many of us and we're so well connected. So it's not okay to transform a forest into agriculture without understanding what that impact has on climate, carbon storage, on disease emergence, on flood risk and flood defences, on climate resilience. You can't do those things in isolation without thinking about all the things that ecosystem provides to humans.
A cost we are quickly realising now. Nick Payton-Walsh, CNN, London.
Wow.
Thank you so much for watching CNN Newsroom. I'm Natalie Allen. Stay safe. Next year, it's New Day.
Good luck to all of us. Coming from the Windmill Ministries here at 291 Thompson Road, Sharon, Tennessee. Good luck to each and every one of us. And shalom.